Namaste. Let us understand sinusitis such that we never forget it again. The definition of sinusitis is inflammation of mucosa of one or more paranasal sinuses. But the term used today is rhinosinusitis. Rhinosinusitis involves inflammation of nasal cavity along with paranasal sinuses. The types of sinusitis are acute and chronic. This is based on duration of the symptoms. If symptoms persist for less than 12 weeks, that is 3 months, we call it acute sinusitis. And if they persist for more than 12 weeks, we call it chronic sinusitis. Let's see acute sinusitis in detail. The most common route of spread is through nose. The causative organisms are viral, most commonly due to common cold, bacterial, and fungal. Most common bacterial causes streptococcus. Risk factors can be local, general, or environmental. Example of local factors are upper respiratory tract infection, that is common cold, which we saw for viral etiology. Then we can have nasal allergy, which causes allergic rhinitis. Then general factors include low immunity, immunocompromised, malnourished patient, diabetes mellitus, and smoking. The example for environmental factor is swimming in contaminated water. Next, let's look at the pathophysiology. The story begins with a viral infection. This viral infection leads to mucosal edema. Due to mucosal edema, there is blockage of osteometal complex. This decreases the ventilation and drainage of sinuses. Then it causes hypoxia in sinuses. Hypoxia leads to reduced pH, and reduced pH damages the mucociliary activity. Because of this, drainage is further impaired and stasis occurs. Due to stasis, bacterial superinfection occurs. Here I'd like to tell you an important point that in bacterial acute sinusitis, we will be able to see a pattern known as double sickening. What is this double sickening? In double sickening, initially, the patient will have a milder phase of viral infection, and later he will have a bacterial superinfection and his condition deteriorates. Due to the mucosal edema, which we saw in the pathophysiology, the patient will present with nasal obstruction. Also, he will present with nasal discharge or postnasal discharge. Due to nasal discharge and obstruction, hyposmia will occur. Hyposmia is reduced sense of smell. Facial pain may occur. In ethmoid sinusitis, pain increases on movement of eye. In maxillary sinusitis, pain increases on movement of jaw. In frontal sinusitis, we have morning headache. And in sphenoid sinusitis, the headache is referred to the occiput. I have explained this in the previous video. On clinical examination by anterior rhinoscopy, we get these findings. We see congestion, edema, and pus in the nasal cavity. Then, on doing endoscopy, we see edema and mucopus in the middle meatus area. This is because most of the sinuses drain into the middle meatus. We treat acute sinusitis with antibiotics. Most of the sinusitis is caused by viruses and it may resolve spontaneously. But if it is bacterial, we have to give antibiotics. We can give amoxicillin and cleveland, that is amoxiclav. Then we give nasal decongestants to relieve nasal obstruction. Saline nasal sprays. We give this to improve the mucociliary clearance. And then steroid nasal spray. Steroid nasal spray is given only if it is severe. What does it do? It decreases mucosal edema. One more point which I would like to add here is positions for installation of nasal drops. We have three positions: Migant, Regan, and Mecca. I'll try to make a YT shot for this one, okay? So we are done with acute sinusitis here, and I'll make the next video on chronic sinusitis. Thank you.